Hello, everyone. We're here on behalf of MOASH, advocating for needs for National Youth HIV Awareness Day. My name is Micah Benjamin, and my pronouns are he, they, and I'm a part of the MyRAT committee within MOASH, advocating for youth and equity needs.
Hi everyone, my name is Dale. I go by he, him pronouns. I am one of the co-facilitators for the SHARE Youth Advisory Council. And I would love to pass you on to Levi.
Hello, everyone. My name is Levi Berkshire. I am the Biomedical Prevention Coordinator within the state of Michigan. I'm also an executive board member on the MOASH, and then I'm also a person living with HIV, and I use the pronouns they, he. It's nice to see you all.
All right, everyone. So we have a few questions for you, Levi. I will start it off. First of all, I just wanted to ask if there are any systems in place that kind of protect minors' sexual health information and privacy.
So just from my experience in working through things, there are some systems that are set in place being able to help and trying to get youth with what they need. So actually throughout the state of Michigan, the state actually does have some programs throughout the state that have programs in actual high schools and in schools to be able to help with being able to test and being able to get services and just making sure that they have the sexual health things that they need. Other than that, thinking about just the explanation of benefits sometimes that get sent home by insurance is sometimes that's actually private insurance, let me say that. So that's actually sometimes reasons why young people don't go access services is because an explanation of benefits will be sent home. So within that explanation of benefits, it's going to talk a little bit about what they received and maybe even a prescription. So if the parents are, sometimes involved, they read those explanation of benefits and then they can see really what's going on. So I think those can be a little bit of a hindrance on why individuals, especially young individuals, don't access services.
Thank you, Levi. And so we talked a bit about services, and I just wanted to hit on some points about youth. And I was wondering, is there any education on HIV and STI prevention provided to K-12 teachers and professionals within the state of Michigan?
So actually, from my understanding, there are districts that do have educators that do go into the schools that do provide education to teachers. The biggest hindrance with this is going to actually be the school districts when it comes to school districts getting to choose what they want to be able to have their youth to learn. So sometimes within the teacher scopes, they really want to be able to get in there and they really want to teach, but then they have to worry about the district that they work in and the requirements that have been set. So yes, there is education that is out there. And actually one of the best things about my job is that I get to provide education and talk to teachers and other professionals about HIV and HIV prevention as a biomedical prevention coordinator. So within my job, it's all things PrEP. So being able to take medication or medication that is prescribed to you to prevent HIV, but education is out there. And I think I was thinking about this when I had seen the question, and really we're fortunate enough to be able to have all the knowledge that we do know, but sometimes people in other agencies or other organizations might not know about it because they don't have the connection. So there is a lot of resources, especially within the Bureau of HIV and STI programs. Just got to get a hold of us and we can get that to you, or you can always look at the websites that we have out.
I loved that answer, Levi. Thank you. It sounds like you do a lot of important work, so we appreciate that. I did want to just ask, so how soon do you think after someone's with a new sexual partner that they should test for a potential STI?
Sure. So this question, I think, is kind of just individual based, but I really think that if somebody is sexually active, if you have one partner or even more than one partner, I think that it's really best for an individual to get tested every 3 months. I just say that because it's your body, your health, and you get to make the decision. So being able to have that conversation with your provider is sometimes hard, but really, I think an individual, if you're sexually active or if you're not in a monogamous relationship, or even if it's, I always talk to my women and I'm like, when you get your yearly once a year, maybe it's a good time even just to get an STI HIV check. Just because, not saying that something's going on, but just saying that you're doing it for yourself. But really, I think somebody, an individual, if they are sexually active or just once a year, but if you are sexually active at least 3 times a year, and then, if you do have a sexual partner and if somebody that's new, maybe in 2 to 3 weeks that you really do go get an STI or an HIV test just to make sure. Especially now within HIV, we also have a test that can test within 14 days. So 14 days after the exposure is a really good time to be able to get tested. You really, you got to remember 14 days and then you can't have any fun in that time, but you just got to remember you can then come back and get tested again if you need to. But things have progressed and we do have 4th generation testing to be able to allow for new earlier detection of things as well. And then actually also in Michigan, kind of something that's really exciting is soon it's going to be the HIV syphilis test. So it's all in one. So that's kind of a nice thing. We have some new pilots that will be happening this year. So look out for new testing that's going to come available.
Thank you, Levi. And I really appreciate you hitting on the points of prevention and understanding to decrease stigmas and to not be afraid of getting tested. And it's okay if you have multiple sex partners and so forth, but prevention is always key. So I just want to hit on some mental health aspects within people living with HIV. So my question is, what are the mental health impacts of youth living with HIV? And we can also talk about adults and so forth of all ages.
Sure. So, honestly, I'm not going to lie. So when, things happen, there's a lot that happens with an HIV diagnosis. Some people might be prepared for it, and some people it might just sweep them right off their feet and they might not have a clue. I am of the age of that it was kind of like put into my mind from my peers, my older peers, people that had talked to me. That's why it's always the importance of getting tested. But even now, thinking about youth and how HIV impacts youth, um, it's still in Michigan. I can say that it's still one of our biggest populations that is diagnosed with HIV, and we still have a lot of room for improvement. We really have to try to make sure that we're trying to meet individuals where they are and trying not to force certain situations or certain services on an individual. But the biggest parts that I always ran into with in my job when I worked with people, others being newly diagnosed with HIV, was like trying to work HIV care or going into providers, because they have a really busy college schedule. So that was something that was really hard for some of my people to be able to get them into care. So I had to do a little bit more as a person helping them access services, which was totally fine. But really is the unknowns of what to expect in the future. Those are some of the things that I think that really affect young people's mental health when it comes to, oh goodness, am I going to die? No. Well, am I going to be able to get in a relationship? Am I going to be able to have children? That actually puts a lot of things within their own selves of trying to figure things out. And I always try to tell them, just try to work through it one by one. If you have a question, you're thinking about it, text me. I might not respond right away, but text me and we'll make sure that you get the right answer. And so that way you're not stressing over it. So it's a lot that comes when the person is newly diagnosed, but a lot of steps that they have to work through, and just know that, HIV is actually pretty well, how do I want to say this? It's pretty well spread out, and a lot of the places throughout Michigan have the knowledge and the things to be able to help people. So I know it's a lot to stress about, but don't worry. You can live a happy, healthy life. You can have kids. You can have healthy relationships. It's just that there's one thing that we have to try to do, and that's take our medicine. So
That was awesome. And so as you explained, an HIV diagnosis impacts a lot of areas of someone's life. I was just wondering if it also impacts potentially the legal aspect of their life. Are there any laws or anything surrounding disclosing your positive HIV status to potential sexual partners?
Sure. So this is it's kind of a twofold thing for me because I'm actually contracted through the state, but I'm also a person living with HIV. So I'm going to give you the person living with HIV's answer because in 2019, I actually helped with the state of Michigan and also, or not necessarily the state, but I also helped to like John Hoadley, who was my state representative at the time, to be able to update the laws. So there were some laws that were updated. They weren't necessarily updated to where we wanted them to be, but I think that the Bureau and others are actually truly like working to update those again, which is super awesome. And then also the fact that we have people that really want to make sure that we're trying to get rid of the laws that will really it does more harm than good, is getting rid of those laws that would come after somebody for not sharing their HIV status, but really making sure that it's just up to date. Because if they're not up to date and if you have laws legalizing HIV, then what happens is that causes people not to get into care, causes people not to access services, it causes a lot more problems than good. So really trying to change that. But currently in the state of Michigan, the law comes down to intent. So if a person is living with HIV and they're actually truly undetectable, so that means that they're unable to pass the virus along to somebody else, it's really up to them to say, hey, you know, I'm a person living with HIV. The law states that they have to, but like I stated, it comes down to intent. That is that biggest piece. So if there was intent out there, then yes, the person is going to get in trouble and they're going to, you know, the laws are going to come after them. But if a person is undetectable, they're, you know, they've been undetectable, they've been taking their medicine, all their labs show that they've been undetectable, there is no intent in there going to give somebody HIV. So me example, I've been undetectable in September, actually 10 years. So I was diagnosed in 2014, May 22nd, 2014. And then I started seeing my provider in August of 2014. And then in September, I was undetectable because I started my medication. So, you know, it's just making sure that you're taking your meds and doing the right thing because it's not just you in this world. There's other individuals that are out there as well. And you really don't want somebody to have to go through what maybe you have gone through. So all there is yes, there is laws in Michigan, but we just have to update them and get them to where they need to be, and things will be a lot better. But really, yes. So individuals should be telling their sexual partners that they are living with HIV, even if they're undetectable, but it's up to that person.
Thank you, Levi, for sharing. And I feel like it's very important to shed light on the inequities that are present within individuals who are living with HIV and the laws that are instated, and hope for a better future with that so we can change it for the better of all people. So I just wanted to hit on one more question from me about youth empowerment. And so how can youth aid in empowerment through advocacy and of individuals living with HIV? And I guess, so today me and Dale are incorporating advocacy through this day, but I guess we're also hitting on a topic of youth that maybe want to be a part of advocacy, but are afraid to speak up. How can they do it behind, maybe just in the room and, you know?
So I'm actually not a person that you would see going out to a march or going out to do that type of thing. I am the person that's going to be in the background and that you're going to see. But also because of that, it's also made me a leader within the HIV community here in Michigan. So twofold, I'm a person living with HIV, being an advocate, doing the things on my own time, but also I'm creating policy and trying to do better and creating at the state level, making myself present and being seen. But some of the things that I've noticed that we could benefit from would be better HIV prevention, better HIV laws in general. And then also making sure that there's just more support. So trying to utilize what we do have, but also realizing that there needs to be a focus change. Not saying that things are broken within HIV, but this generation is the younger generation is a lot different than what my generation is. I'm one of those older millennials. Things are a lot different, and just being able to make the access and how access has changed and how to be able to reach people, all that has changed. So we really need to have more youth involved to be able to make sure that things are done in the right way now. And that's really where we need to make sure, if it's like joining a group, just sitting along, like, so like for perfect example is the Michigan HIV/AIDS Council. I was the co-chair for them for 3 years. The youngest person that we had on that council was 25, and the youngest that we can accept was 18. So there is a lot of space, that there was a lot of room for improvement, but us to be able to make those connections were really hard sometimes, because youth is so involved in what they've got going on in their lives and the things that are happening, but also just being able to make that presence. Also, if it's just sending an email saying, hey, I was just at this meeting, I think that it would be a really good idea if you could look into this. You don't always have to speak up at that time, but you could always send an email, write a letter, send a text message, anything, just saying, hey, I was at this meeting, or hey, I was listening to what you were talking about, and this would be really helpful. But don't just criticize, make sure to give an example of what would be helpful. That way that they can have something to go back and look at, and that way that they know what you're talking about is going to be something that would be beneficial for a large group.
Very nice. Something that you've hit on a few times today, is kind of the emphasis that just because someone may be HIV positive doesn't mean they can't live a long, happy and healthy life. And I know that an HIV diagnosis in certain stages of life could be more challenging than others. So I did just want to ask, to close out the interview questions, is what one thing would you like to say to a young person who's just been diagnosed with HIV, and kind of have a lot of anxieties about their condition in the future that's in store for them?
Sure. And that's a really good topic, and something that you hit on, Dale, is the fact that somebody's diagnosis is going to be different within their journey. Some people are actually diagnosed later, and that's actually where you'll become like, get an AIDS diagnosis, thinking, or like an AIDS, a higher AIDS diagnosis, but then also thinking that, everybody's journey is different. So thinking about just the fact that, yes, the one thing that's going to be the most common within all of that is going to be HIV. But also remember is that everybody's going to have a different life, and how things are and what falls into their life and how they can handle things. But one thing that I can also say is when I was diagnosed at 30. So for me, even to be diagnosed 10 years ago, I thought I was like, okay, so now I'm going to have to tell my parents that I'm going to die. These are the things that we're going to have to work through and figure the things out. I didn't know that there was all these things out there, didn't know about medication, didn't know about services, didn't know about anything. So I did a lot of the things by myself. I didn't have to, but I did them. But there are services that are out there to be able to provide the help. Let them help. Let them be able to help with housing. Let them be able to help with food. Let them be able to get any resources that are available to you. Being able to allow them to do that work, and you just go do your job, go to school, do whatever you got to do, and take your medicine, and really allow them to be able to help and work through those processes. Those are the big key things that I learned after starting to do this work, is that there are services that we have available for people. These are all government funded services. It all comes to the state disperses it throughout the state, and then there's agencies out there that truly can be able to step in, help you with whatever that you need, and being able to get what you need to better improve your HIV story. So thinking about if somebody's diagnosed and they actually truly are not doing so well, that's really because they were tested late. They were tested too late. Now there are some young people that I worked with, one young man who passed, but that was because it was a late diagnosis and it really affected his kidneys. We don't have to get there anymore. Really, is just remembering is that we can diagnose, we can treat, and we can get you to where your treatment is prevention, which is known as TASP. And then you're also known as U equals U, so undetectable equals untransmittable, so that a person is not able to transmit the virus sexually. So we've got the tools, we just got to make sure that everybody understands and knows that they're out there. And, even sometimes when we're in school, we get all these, like high school, we get all this information. We're in sex ed or we're in health class and we're still getting all this information. But how much do we truly take in if we don't realize that's going to affect us in the long run? So just always got to try to remember to do our best. But the people providing the services, meet that individual to where they are and try to do your best to make sure to provide that service in a way that's going to allow that person to be able to help make the decisions of what's going to work best for them.
Thank you so much. We really appreciate you answering some questions for us, and I think this has provided a lot of clarity and honestly hope to people who maybe in the future will have an HIV diagnosis, or those currently living with one. So thank you.
Absolutely, and thank you for being able to ask me the questions. I think the fact that we just have so many options and just having to people to make sure that those options are available and out there for them sometimes is the hard part, but we just have to make sure to keep continuing and making sure to have those conversations with everybody. And I really think that things could probably change. I mean, it just takes work. The one thing I always say is that within HIV, you know, the H is human, and that all you have to be is human to be able to contract HIV. And you contract HIV in multiple different ways. So just trying to think about the best ways that how it could interact with you. And, you know, there's plenty of people that were like, I didn't think I could get HIV because I'm not gay. So just remember, all you have to be is human, but all you have to do is treat another human like a human. So just be kind and be nice.